to the American.
Let me just ask you. Let me ask you a point of clarification. Do you think Medicare for all is socialism?
Well, I think if the government overtakes an entire sector or entire industry, that's the proposal, that would be socialism.
Andrew here with the Veil of Power. Scott Jennings spent an entire CNN segment calling progressive Democrats, socialists, and radicals abolish the police, abolish borders, radical anarchy, antithetical to America. He was really feeling himself. Then Jake Tapper asked one clarifying question. Do you think Medicare for all is socialism? Jennings said, yes, absolutely. If the government takes over a whole sector, that is socialism. And then someone at the table dropped the number that ends the debate. The current American healthcare system, the one Jennings is defending, will cost $72 trillion over the next 10 years, and it still does not cover every American. So let's get into it.
Sanders of Vermont last night in Michigan campaigning with progressive Senate candidate Dr. Abdul Al-Sayed, who we had earlier on the program. My panel joins me now. Congresswoman Kelly from Illinois, so you have a sense of what's going on in the Midwest. Bernie Sanders there very clearly suggesting that establishment Democrats are not the key to change. These progressive insurgents are. What do you think?
I think it depends on who we're talking about. Like Diana DeGette just lost, and she was one of the founders of Medicare for All. Just because you've been there a long time doesn't mean that you're not progressive or you're not doing what progressives want you to do. I think that it seems like experience, because you have experience, that makes you established, and some people don't want you, but not everybody, of course.
Corbin Trent, co-founder of Brand New Congress, co-director of Justice Democrats, former communications director for AOC, just in case the folks out there aren't sure who you are. I suspect that you have a different view.
I mean, I think that, just because you were one of the original supporters of Medicare for All, we've gone a long time trying to get things like that passed. I think, people are looking for results, not just your indications of what what you stand for. They want to see change, and I think that we've gone decades and decades without it, not going in the right direction at least, and I think that's the key.
Republicans went through something like this about 15 years ago.
With the
The
Tea
rise
Party.
of the Tea Party movement. Yeah. And what that led to were, in some cases, folks running who were taking on, the establishment favorites who won and actually have become really strong members of the United States House and Senate. Marco Rubio being a great example, not endorsed by the D.C. establishment, but took it on anyways and won. But then there were lots of other instances of somebody running, defeating a more establishment candidate, and then it sort of throwing the election away. And I do think the Democrats are at risk now in a variety of seats. I mean, you saw this, now it's happened in Maine, where Susan Collins is now not as vulnerable because of all of the disaster happening there. This could be the case in Michigan as well. If Democrats nominate someone from the more extreme wing of the party, that could lead to a less favorable environment for them, even in a moment just like in 2010 for the Republicans. Great election for the GOP that year, but did they leave seats on the table by still having nominees?
I think to boil this down to just insurgent versus establishment overlooks what many of these people are running on. They're simply beyond insurgency here. I mean, you've got people out there winning primaries that want to abolish borders, abolish ICE, abolish prisons, abolish the police, abolish the United States Senate. I don't think the Democratic Party leadership understands. They've already been overwhelmed, and it's just a matter of time before these views become the mainstream platform, and that's what they're going to end up running on in 2028 as well.
I think we do understand. We talk about it all the time in the Democratic caucus. We know we're a big tent caucus, and that we're not all going to agree, but the one thing we agree on, we know we have to win. And that's what we're concentrating on.
To do what? To do these things that they're laying out in these... I mean, I know I know you probably don't agree with these things.
We cannot go back to business as usual, though. It wasn't perfect under us. We know we need changes. We know we need health care for everyone. We know we need better education. We know we need better housing, and we have to do all those things.
Do we need police? Do we need prisons? Yes, do we need border enforcement?
You don't hear most of us saying that. Yes,
and
we need
the
police,
fact is, though,
but not in the same way that ICE.
I mean, the Tea Party, for example, it came out, it wants to abolish the Department of Education. It wants to abolish...
So did Ronald Reagan.
They want to abolish
So did Ronald Reagan.
Abolish this, abolish that. Privatize Social Security. Put that in the stock market and see how it does. If it crashes,
would have done great had they done it back in 05.
Until it doesn't, right? Until it doesn't, which is what happened in the 1930s when people were struggling. And I think that's what we're seeing right now is a moment sort of like we had in the 1930s in America, where people are tired of the way things are going for them, and we're going to see a transformation in the way our politics is done, and hopefully we'll see a Democrat.
I agree. The anti-Israel, the anti-Jewish rhetoric, it does remind me of the 1930s. I couldn't agree with you more.
There is no question that the anti-fascism is also rising, and the fascists were on our shore back then. And what we're committed to now is fighting what? Socialists? I mean, the idea of having health care that everyone
Communist,
can...
socialist, very antithetical to the American system.
Are they the same or are they different? Because I think socialism, TVA, where I'm from, East Tennessee, was built by socialism. The TVA was built by it. Oak Ridge was built by it. Factories were built by it. Alcoa was built by
socialism?
America, absolutely. Government workers, 90% of the people that built those
Having a government is not the same as having
things.
Socialism.
Well, so if it's not the government doing the work and the government building things for the people and then keeping ownership of it, if that's not what socialism is, then what is it? You tell me.
You're saying any level of or any amount of government is socialism.
I think your guys are, actually.
We're not the ones
that
running
label all this stuff.
You have a whole faction of your party called Democratic Socialists of America who are running on things well beyond basic government services. They're running on absolute and total radical anarchy that is antithetical to the American.
Let me ask you a point of clarification. Do you think Medicare for all is socialism?
Well, I think if the government overtakes an entire sector or entire industry, that's the proposal, that would be socialism, absolutely. And there are countries around the world that engage in socialist practices where they have taken that over, and the outcomes for those people in many cases are terrible. Are we going to have the government running entire sectors of our economy, such as healthcare? Conservatives don't believe in that.
And we took a look in some polling that I did just this past week about Medicare for all, because we know it's going to be more of a topic of conversation, especially as more of these sort of very progressive folks win in these primaries. What a lot of voters say is they say, great, if we can do it by taxing the rich, that's wonderful, but don't you dare raise taxes on me. And I think this is where, for some of the folks in the DSA sort of movement, when the rubber hits the road, that's where this friction on the Democratic Party comes along, where the establishment says, that's nice, but we've got to do stuff that actually works. And they still may get overtaken.
The current system we have right now, $72 trillion is what it's going to cost us over the next 10 years. Our current health care system, $72
called
trillion.
Obamacare, by the way.
So you're talking about all the health insurance,
all the health
agencies,
insurance,
hospitals, everything.
Everything.
Yeah.
The entire thing is going to cost us. That's an unsustainable, and that's not even covering every American. That's the current system.
So let me ask you a question, Congresswoman. Medicare for all, it seems like that is about to become, if not already has become, the Democratic Party platform. Mm-hmm. Is that fair to say? Does that get rid of insurance companies, or does that just provide like the public option as they used to talk about with the Obamacare?
You know, as was just said, it's been around for a long time. There's different iterations, but I think that it's going to be the foundation of what we do, because we still don't have health care for everyone. And in the richest country in the history of the world, we need it. I was going to say, my husband, we were in Canada. He got sick. He was in the emergency room 3 days. His health care bill was $800 for 3 days. And then you could not do that in the United States of America, being in the emergency room 3 days and only $800. And he received very good treatment.
I think describing the Canadian system where people wait weeks and weeks or months and months and months for very basic healthcare procedures, you do not want that here. I promise you. We have the best healthcare system in the world. We have the best doctors in the world. To force people into a system where they got to wait months and months and months to get a knee surgery.
They don't even wait here, Scott, because they don't even try to go.
You have to
That's
wait.
not true.
But you have to wait
knee
here.
surgeries here all the
You have to
time.
wait here also. And my husband, he's not alive anymore, but he was a doctor.
Yeah.
So I know.
How does this stuff poll with the independent voters? Like, how much is the DSA platform? Well, let's not take the most extreme members of the DSA area and talking about no borders, no jails, et cetera. But let's just like Medicare for all, more taxing of the rich. How does that play?
So those two things test very differently. Taxing the rich is something that you even find some folks on the more conservative side of the aisle being a little bit more open to, Donald. But there is a lot of stuff that is very far left that is not where independents are at. Do they want someone who's an outsider? Yes. Do they want people who are going to fight? Yes. Do they want them to fight for checking the box of everything that the far left wants? Absolutely not. And that's what I think is leading to Democrats having this political environment that's really favorable to them. When you're the party not in power, you got the wind at your back. And if they choose candidates who are way far out there, they're going to throw away seats that could have been available to them.
You can't have this conversation without talking about, you wanted to exclude the extreme positions. The extreme positions are becoming the mainstream positions, including this anti-Israel, anti-Jewish rhetoric, which has infected all of these primaries out there.
Last word.
Well, I mean, the fact is, though, is that I wrote a piece called How to Sell a Tractor. right? And from East Tennessee, when I'm selling a tractor, if I know that I want $15,000 for that tractor, I don't start off asking $15,000. I ask 25 maybe, or 18. Then I work my way down. So you have to have a position staked out a little further than where you want to end up. So I think far left is good.
All right, everyone, thank you so much. Really appreciate it. Great conversation.
Let's take Scott Jennings at his word, because that is where this falls apart. He gave a clear definition. If the government takes over an entire sector, that is socialism. Fine, let's apply that definition consistently, because it only means something if it holds up when you point it at everything, not just the thing you already dislike. The Tennessee Valley Authority is a fully government-owned utility that brought electricity to rural America. Socialism by Jennings' own definition. And here is the beautiful part. His own co-panelist from East Tennessee pointed out that the TVA Oak Ridge, entire towns and factories in his region, were built by exactly that kind of government work. The interstate highway system, socialism by that definition. Medicare, which already covers 65 million Americans, and ranks among the most popular programs in the country. Socialism too. Social Security, which keeps tens of millions of seniors out of poverty. Socialism too. The VA health system, serving millions of veterans. Socialism too. Now sit with a pattern. Every one of those programs was called radical and antithetical to the American way when it was proposed. And every one is now so woven into American life that no serious politician in either party would dare campaign on abolishing it. The word socialism gets slapped on anything new right up until it becomes the thing people would riot to protect. Jennings is not making an argument. He is running a 90-year-old script, and the ending is always the same. Now the number and the current system, private insurance, private hospitals, private pharma, the one Jennings considers superior to any socialist alternative, will cost $72 trillion over the next 10 years. That is not the price of Medicare for all. That is the price of the system we already have. And here is what 72 trillion buys. It still leaves millions uninsured. It still leaves millions more underinsured. It still produces more medical debt per person than any other developed country on Earth. And this is the part that detonates the talking point. Americans already pay more per person than Germany, France, Canada, the UK, Australia. Every country conservatives cite as proof that government healthcare produces worse outcomes. We pay more than the countries with socialized systems, and we get less, more money, worse coverage, more debt, millions left out. So when Jennings warns the socialist alternative would be unsustainable, ask him what word he would use for a system that costs 72 trillion and still cannot cover everyone. Then there was the moment that quietly said everything. The Congresswoman mentioned her husband got sick in Canada 3 days in the ER, bill $800. Jennings' reflex was to attack wait times. But notice what he did not do. He did not dispute the $800 bill. He could not, so he changed the subject. And here is the detail he talked right over. Her late husband was a doctor. When someone who spent their life inside medicine tells you the other system charged $800 for what would bankrupt an American family, that is not naive. That is a witness. Here is what the socialism debate is designed to do. It is a distraction from arithmetic. As long as everyone argues about a scary label, nobody has to defend the $72 trillion bill or explain why a nurse in Ohio pays more and gets less than one in Toronto. The label is the whole strategy, because the numbers do not survive daylight. The current system is the expensive one. It is the one that leaves people behind, and no amount of name-calling changes a single digit of that. So the next time someone shouts socialism to end a healthcare conversation, Ask them the one question Jennings could not sit with, compared to what? If this broke it down for you, drop a comment and subscribe. And you're out. Let's go.